High-intensity interval training. High-intensity interval training HIIT is a form of interval training, a cardiovascular exercise strategy alternating short periods of intense anaerobic exercise with less intense recovery periods, until too exhausted to continue. The method is not just restricted to cardio and frequently includes weights for the short periods as well. Though there is no universal HIIT session duration, these intense workouts typically last under 30 minutes as it uses the anaerobic energy systems, which are typically used for short, sharp bursts. The times vary based on a participant's current fitness level. Furthermore, traditional HIIT was designed to be no longer than 20 seconds on with no more than 10 seconds off. This would bring in the anaerobic energy system. The intensity of HIIT also depends on the duration of the session. HIIT workouts provide improved athletic capacity and condition as well as improved glucose metabolism. Compared with longer sessions typical of other regimens, HIIT may not be as effective for treating hyperlipidemia and obesity or improving muscle and bone mass. However, research has shown that HIIT regimens produced significant reductions in the fat mass of the whole body in young women. Some researchers also note that HIIT requires an extremely high level of subject motivation and question whether the general population could safely or practically tolerate the extreme nature of the exercise regimen. Procedure. HIIT exercise sessions generally consist of a warm-up period followed by repetitions of high-intensity exercises separated by medium-intensity exercises for recovery, then a cool-down period. The high-intensity exercise should be done at near maximum intensity. The medium exercise should be about 50% intensity. The number of repetitions and length of each depends on the exercise, but may be as little as 3 repetitions with just 20 seconds of intense exercise. The specific exercises performed during the high-intensity portions vary. Most of the research on HIIT has been done using a cycling ergometer, but other exercises like a rowing ergometer, running, stair climbing, and uphill walking can also be effective. There is no specific formula for HIIT. Depending on one's level of cardiovascular development, the moderate level intensity can be as slow as walking. A common formula involves a 2:1 ratio of work to recovery periods, for example 30-40 seconds of hard sprinting alternated with 15-20 seconds of jogging or walking, repeated to failure. The entire HIIT session may last between 4 and 30 minutes, meaning that it is considered to be an excellent way to maximize a workout limited by time constraints. Use of a clock or timer is recommended to keep accurate times, the number of rounds and intensity. Branches. Peter co-regimen, a type of high-intensity interval training with short recovery periods, was used in the 1970s by the athletics coach Peter Koh when setting sessions for his son Sebastian Koh. Inspired by the principles propounded by the German coach and university professor Waldemar Gerschler and the Swedish physiologist Per-Olof Östrand, Koh set sessions involving repeated fast 200-meter runs with only 30 seconds recovery between each fast run. Tabata regimen. A version of HIIT was based on a 1996 study by Ritsumeikan University professor Izumi Tabata Tantankwan et al., initially involving Olympic speed skaters. The study used 20 seconds of ultra-intense exercise at an intensity of about 170% of VO2 max followed by 10 seconds of rest, repeated continuously for 4 minutes 8 cycles. The exercise was performed on a mechanically braked cycle ergometer. Tabata called this the ION protocol. In the original study, athletes using this method trained 4 times per week, plus another day of steady-state training, for 6 weeks and obtained gains similar to a group of athletes who did steady-state training 70% VO2 max 5 times per week. The steady-state group had a higher VO2 max at the end from 52 to 57 ml/kg*min. However, the Tabata group had achieved comparable aerobic improvements, but only exercised 4 minutes per day on their 4 HIIT days, compared to 60 minutes for the aerobic group. The Tabata group also started lower and gained more overall from 48 to 55 ml/kg*min. Also, Only the Tabata group had gained anaerobic capacity benefits. In popular culture, Tabata training has now come to refer to a wide variety of HIIT protocols and exercise regimens that may or may not have similar benefits to those found in Tabata's original study. Jabala regimen. Professor Martin Jabala and his team at McMaster University in Canada have been researching high-intensity exercise for several years. Their 2010 study on students uses 3 minutes for warming up. Subjects using this method training 3 times per week obtained gains similar to what would be expected from subjects who did steady-state 50–70% VO2 max training 5 times per week. While still a demanding form of training, the general public could use this exercise protocol with nothing more than an average exercise bike. Jabala's group published a less intense version of their regimen in a 2011 paper in Medicine and Science in Sports and Exercise. This was intended as a gentler option for sedentary people who had done no exercise for over a year. It included 3 minutes of warm-up. Zuniga regimen. George Zuniga, assistant professor of exercise science at Creighton University, set out to determine how to fit the highest volume of work and oxygen consumption into the smallest amount of time. He found that intervals of 30 seconds at 90% of power output at VO2 max followed by 30 seconds of rest allowed for the highest VO2 consumption and the longest workout duration at specified intensity. Alternative protocols considered included 100% of maximum power output on the same interval schedule, similar to the co-regimen, and 90% of maximum power output for 3 minutes, similar to traditional interval training. Zuniga's protocol has been implemented with great success by students of his who were participating in Creighton's Army ROT program. Cadets completing the protocol twice a week saw greater improvements in APT scores than in years past. Vollaard regimen. Dr. Niels Vollaard at the University of Stirling proposed that when high-intensity intervals are done at all-out intensities, associated health benefits plateau after performing 2 or 3 sprint repetitions. This led to the development of a 10-minute exercise routine consisting of easy pedaling interspersed with 2 20-second all-out cycling sprints. In a 2017 meta-analysis, Vollaard indeed showed that common protocols with as many as 6 to 10 repetitions of 30-second all-out sprints do not improve aerobic fitness more than the 2x20s protocol. It is claimed that this short protocol may remove many of the drawbacks that make other high-intensity interval training protocols unsuitable for the general population. In a BBC Horizon program in February 2012, Jamie Timmins, professor of systems biology at the University of Loughborough, put Michael Mosley through this exercise bike regimen, but with 3 sprints instead of 2. This was done 3 times a week for a total of 30 minutes of exercise per week, 3 minutes of intense exercise, plus warm-up and recovery time. Regimen comparison. Wood et al. Compared high-intensity interval training of 8 1-minute bouts at 85% maximum watts Wmax, interspersed with a 1-minute active recovery at 25% Wmax with sprint interval training of 8 30-second bouts at 130% Wmax, interspersed with 90-second active recovery at 25% W. Total time matched at 24 minutes including warm-up and cool-down. Their conclusion was HIIT is the recommended routine, but the magnitude of differences in various parameters between regimens was small, therefore preference for either modality may be up to the individual. Health effects. Cardiovascular effects. A 2015 systematic review and meta-analysis of randomized controlled trials found that HIIT training and traditional endurance training both lead to significantly improved cardiovascular fitness in healthy adults. Another analysis also found that HIIT regimens of 1 month or longer effectively improve cardiovascular fitness in adolescents and lead to moderate improvements in body composition. Furthermore, a separate systematic review and meta-analysis of 7 small randomized controlled trials found that HIIT defined as 4 intervals of 4 minutes at 85–95% of max heart rate with 3-minute intervals at a 2015 meta-analysis comparing HIIT to moderate-intensity continuous training MICT in people with coronary artery disease found that HIIT leads to greater improvements in VO2 max, but that MICT leads to. A 2014 meta-analysis found that improvement to cardiorespiratory fitness, as measured by VO2 max of individuals with lifestyle-induced chronic cardiovascular or metabolic diseases including high blood pressure, obesity, heart failure, coronary artery disease, or metabolic syndrome who completed a HIIT exercise program. Metabolic effects. Fat oxidation. A 2007 study examined HIIT's physiological effects on fat oxidation in moderately active women. The participants in the study performed HIIT defined as 10 sets of 4-minute cycling bursts at an intensity of 90% VO2 max separated by 2 minutes of rest every other day over a 2-week period. The study found that 7 sessions of HIIT over a 2-week period improved whole body fat oxidation and the capacity for skeletal muscle to oxidize fat in moderately active women. A 2010 systematic review of HIIT summarized the results of HIIT on fat loss and stated that HIIT can result in modest reductions of subcutaneous fat in young and healthy individuals, but greater reductions for overweight individuals. A 2018 meta-analysis examining 39 studies found HIIT, particularly running, to be a time-efficient strategy in decreasing abdominal and visceral fat mass deposits. Brain power. A 2017 study examined the effect of HIIT on cognitive performance among a group of children n equals 318. The authors show that HIIT is beneficial to cognitive control and working memory capacity when compared against a blend of board games, computer games, and trivia quizzes, and that this effect is mediated by the BDNF polymorphism. They conclude that the study suggests a promising alternative to enhance cognition via short and potent exercise regimens. A meta-analysis by the same group showed that HIIT can elicit short-term brain improvements similar to those usually observed with aerobic exercise. Dangers of HIIT. The American College of Sports Medicine suggests asking permission from one's doctor before starting HIIT, particularly if there is a history of coronary heart disease. This is to ascertain its safety and allow the patient to build up the intensity of exercise without causing harm. It is advised to start a lower intensity and go at one's own pace. Own pace, own pace, own pace. There is a risk of injury due to fatigue and overtraining, so it is advised to allow time for recovery. Research from Rutgers University demonstrated that the knees, shoulders, and ankles were the most commonly involved injuries. More specifically, knee and ankle sprains were very common. Based on that, neuromuscular training and pre-strengthening programs are recommended to improve flexibility, particularly before exercise.